So this is an introduction to what a healthcare assistant is and does in British Columbia, Canada. We're going to cover the various names and titles used throughout North America. We're going to look at how BC is set up with regard to health authorities and how this affects potential employers. And finally, we're going to cover regulation and the Care Aide and Community Support Worker Registry. In the next video, we'll look at the various types of workplaces and what you would do on the job as a Care Aide. But for now, let's get started. So the name of programs in BC has changed over the years. So about 20 years ago, it was called Long-Term Care Aide, and then it became Residential Care Attendant before it became what it is today, Healthcare Assistant. And as a result, you see people that have worked on the job for 30 years. You're going to see a great variety of titles being used for care aides, and you'll see name tags in one workplace that differ greatly. Titles may have something to do with collective bargaining agreements and the official job titles, and it becomes difficult to change those official titles without involving a lot of red tape. So when myself and my fellow graduates were hired by the same employer, some of us got name tags that said LTCA and others got RCA, neither of which reflect our certificates as HCAs. So there just doesn't seem to be any rhyme or reason sometimes. You'll see at the bottom here, we've got Personal Care Attendant, which is a title that's used at St. Paul's Hospital. And then you've got Home Support Workers, which are what's used when you work in the community for home support. So in BC, you can see those two titles right here, HCA and Home Support Workers. So home support workers have also taken the healthcare assistant program, so they are technically HCAs. And HCA is also used in Alberta, healthcare aide, though, instead of healthcare assistant. And then you've also got home support worker being used in Quebec and Nunavut. And the one that you'll see, this should say home support worker. The one you'll see a lot or hear a lot is personal support worker, and that's because Ontario tends to dominate with everything. So in the US, they may be called personal care assistants or PCAs, nursing assistants, unlicensed assistive personnel or UAPs, which is a phrase that I see throughout my nursing textbooks. But the United States also has a CNA, or Certified Nursing Assistant, as opposed to this unlicensed assistive personnel. So the CNA is, those are licensed care providers. Although I'm not really familiar with the US, it seems that most states have a CNA licensing exam or board. So this map shows the five main health authorities in BC. But there are actually 8 health authorities. So I've got those listed here. So these bottom 3 health authorities operate within the 5 regional health authorities. So Provincial Health Services operates Children and Women's Hospital and the BC Cancer Agency. So they're operating in Vancouver Coastal Health and Fraser Health region. And then, of course, BC Cancer Agency has satellite services in a lot of the major hospitals. So even Prince Rupert, Port St. John, Powell River, they have, chemotherapy available for patients, and that's done through the BC Cancer Agency. Then we've also got Providence Health, which is St. Paul's Hospital, and a number of other hospitals in the Lower Mainland and services. So that is run by the Catholic Church. However, there is this religious affiliation, but it's not reflected in the overall operations or the employees. And so those services are the Lower Mainland as well. And then we've got the First Nations Health Authority, which is operating throughout the entire province. That was started in 2013, much needed, and really glad to see that. So let's talk about regulation. So when we say regulation, we mean law. So technically, there is no regulatory body for healthcare assistants, which puts them in the same category of unregulated care providers as any Joe off the street. But there is a difference. So although any Joe off the street and a healthcare assistant are both technically unregulated care providers, healthcare assistants will be registered. So the majority of unregulated care providers are family members, caring for family members, friends, and community volunteers. And then you've also got people who are hired to take care of either the person hiring or a family member. And those people would be unskilled, untrained workers. And the other unregulated care providers would be healthcare assistants who, although unregulated, are not unregistered. And so let's try and provide a little bit more clarity for that. So we've got this is the website for the Aide and Community Health Worker Registry. I know it's a little bit old here, but nonetheless, the website still pretty much looks the same as this. So although there's no regulation currently in place in BC, or from what I can tell elsewhere in Canada, that's not to say that HCAs have no accountability. So the term unregulated care provider is a little bit misleading. As an HCA, I would never associate myself with something using a negative prefix, as in unregulated. I consider myself, and I know my coworkers consider ourselves, trained professionals, and we are fully accountable for our actions. And that is partly to do with this registry. So this registry is run by the Ministry of Health. It was started in 2010, and it is accessed by both healthcare assistants and employers. And basically what happens is when a healthcare assistant completes their program, they can apply for a registry number, and that registry number allows them to then work at any publicly funded facility in BC. Without that registry number, you cannot work at a publicly funded facility. So that doesn't leave a lot of room for places for people to work if you are an unregistered care provider. So basically, if someone has received proper training, they're going to have this registry number. And the other people that can also get a registry number are nursing students and people who have completed training outside of BC can apply to have their education evaluated and can potentially get a registry number that way. But it is not a quick and easy process. So this is the best way to find a care provider, is to go through the registry. And even people that work at some of the large private facilities in BC, you cannot get a job there unless you have a registry number. It's really, you're only going to see this in small facilities or private homes. And that's where you're going to find the unregulated care providers that are also unregistered. So yeah, so this registry basically makes it so that employers have to report if they have an employee who has been involved in abuse within 7 days, and that the registry will then likely remove that person's registry number, and they will no longer be able to work at any publicly funded facility. So just to wrap that up, basically unregulated care providers, when it comes to HCAs, is probably going to be a thing of the past very quickly, because we are moving in the direction of registration. That process is in the works as I speak, and I hope it is up and running very soon, although I highly doubt it's going to be self-regulation. I think it's going to be something that is done via the Ministry of Health.